Day in the life, let's see if you really trap. Turn off the auto-tune, let's hear how you really rap. Ha ha, send a location. Come burn up, boy, if you're bad, let's see. Your dad left home from young and you ain't done for your mum, oh man.
Today was good. So in the morning, basically, the GP asked like, oh, what do you want to do? And I said, like, I want to clerk patients and also I want to practice taking blood. Now, this is the thing, yeah. You know, for placements, say, I wasn't that confident at taking blood with a Vacutainer. I've always used a butterfly at the hospitals. It's a bit cheating, yeah, because I think it's a bit easier. But I still asked, can I practice that? Because, you know, taking blood is important when you become an F1. And that's the thing, like, we need to work on your weaknesses, yeah? That's the only way you're gonna learn to practice and actually do stuff. But also, if someone asks you, do you wanna do this? But you're kind of nervous or you're not confident, don't think about it, just say yes. As long as it's safe, as long as you're within your competency, like, just say yes, that's it. And have a go, that's it. Like, that's the main thing. With the HCAs, I learned a lot from them. And I've become a lot more confident. This time, now I'm gonna jump on taking blood. Like, now, if I see any blood flying about, you know I'm there with my two fangs going, because they call me the Dracula baby. But yeah, like, practice makes perfect. And then I did telephone consultations. So one patient, they were depressed and they basically wanted their sertraline, which is an antidepressant, an SSRI, I think, to be increased from 100 milligrams to 150 now. Another patient, so it was about a 2-year-old, and I spoke to the mother, and basically they had this green gooey sticky bogey stuff around their left eye. We gave her some eye drops. I think there's some antibiotics for her as well to have. And then there was stuff like there's a baby check, so I helped with that as well, checking for the fontanelles. Like, it's really cute, but baby check's always cute, especially when they're well as well. The baby is so cute. This baby kept on farting, bro. Luckily I had my mask on and luckily it did not smell, because if I smelled something, yeah, you know, I've got the strap on me, you know what I'm saying? There's that, and then one of the doctors had this sick, oh my days, this otoscope, yeah, oh my days, yo, this was 4K, right? I've been looking in years with these rubbish other otoscopes in, like, you know, 420p or 720p, yeah. This otoscope that I use today, yeah, imagine actually being able to see the tympanic membrane in, not just being able to see it, but in HD, high definition, 4K, Samsung TV. Brilliant. I loved it. This sounds weird, yeah. I was getting excited to actually be able to see the ear, and I could actually see, oh yeah, like redness around the sort of external meatus, whatever it's called, the ear canal. She had tenderness around her mastoid as well, and other parts of the ear. And then today I did my first digital rectal examination on this male who was, he basically had a high PSA and who had blood in his sperm as well. So it's pointing towards, I think that's more prostate cancer, basically. Yeah, I'm proud of myself because this isn't something a lot of people can do, like do a digital rectal examination. Most people would just say no. And I can understand, obviously, because obviously it's not the most pleasant of things. Basically, if you don't know, you're sticking your finger inside someone's anus and like basically feeling around for their prostate, which is not pleasant, but essentially it's so important. And that's why I feel proud, because I feel like I've contributed to this person's care. Like, what I have done is I've felt for this person's prostate, and I'm basically checking if they've got sort of prostate cancer, checking for something that can, you know, that can potentially kill them. So it's really important, and I'm glad I sort of did it, because I'm gonna have to do it anyway. But there's no point avoiding it. I can start avoiding it when I become like a consultant, inshallah. But you know, even then, it's an important job to do. So all in all, I'm happy about today. I'm a happy chappy. Yesterday, I did a digital rectal exam with someone else. Today, I received one. No, jokes. Basically, I'll talk about one patient. One patient was, basically it's an angry patient, innit? Frustrated. I'm on the phone like, inside, I'm like, please, just leave me alone. Understandably so, this person was very worried for their mother, because they were going in for a knee operation and the blood test came back and it was too low to do the operation. And so I think the nurse mentioned something about a blood transfusion. So then the daughter came very worried and was calling, was like, right, you know, like my mum needs to be seen right now, needs to be given blood transfusion right now. this, that. I was so worried, understandably, because that in her head, that's what needs to happen. And if it's your mum, it's your mum, innit? Anyway, so the main concern was about blood transfusion. The daughter was like, no, we need to deal with it now. I was getting frustrated, understandably. But I spoke to the GP, like, fed back, and she was like, look, if the blood test came back and if it was low enough to warrant a blood transfusion, the staff at the hospital where the blood test was done would have been duty bound to give that blood transfusion right there, right then, or at least send her to the A&E. I told that to the patient then afterwards, and I reassured her, and that calmed her down basically. But before, she told me, you're not understanding. I'm like, oh man, make me understand, man, please. But it's good because after getting off that call, I was talking to the GP and I was thinking, I was nearly gonna ask, would you mind speaking to this patient? Because they're a bit angry. But you know what? Remember, placements, say yes, try it, do it. Baby, we did a blood today as well. Apparently it was hard. Apparently not hard enough, baby. Come on. But I'm happy, alhamdulillah, because I was thinking, oh man, this is gonna ruin my day, like this patient. That's the other thing the GP was saying, like, when you leave the hospital, or your placement, you can't let these patients like be on your mind. It's a handover for a reason. You're handing over the patient, so hand over those worries. Don't let them, eat away at you. You shouldn't be worried about anything over the weekend. You shouldn't be worried about anything over when you go home. This is the thing, like, you can only do so much as a doctor. That's the thing with patients, in it. Like, sometimes you've got to be firm with them and say, like, look, this is what we can do. It just took reassuring them, actually, because she was basically worried that she needed something now, but actually she's gonna get a blood test done. Yeah. The other frustrating thing was that the hospital, the care that they were at, apparently sent us emails, but there's nothing on the system, so it's like, oh well, sorry, we can't see anything. Like, I appreciate, like, it's frustrating because, like, they've said they sent it twice and then we've not received it, but yeah, I'll talk about the rest of the patients in a bit. I didn't actually receive a digital rectal exam. I was joking. It was a metaphor. Yeah, man. Yeah, man. Yeah, man. Why are you so far away? Don't be shy. Take some more. So, just got back. Let's talk about some patients. Let's talk about what I did. So, I arrived 9:30, said hi to the GP, Wagwan, what are you saying? Then she looked at a list of patients and then set me up with some patients to call. So I think I had like 3 or 4, basically, 4 patients to call. First patient was that daughter who's very sort of frustrated about mum, so I've already talked about that. The second patient, well, let me see, I made sure to write this down, man. Yeah, so the next patient was 52-year-old female presenting with back pain. Basically, for the past week, they've been experiencing this lower left back pain, which comes on randomly and it's quite sudden as well. It's like a twingy type of pain. So when it comes on as well, then they can't really move. They're just sort of stuck there for a bit. It doesn't spread around anywhere else. It's been happening for less than a week, although they've had back issues for the past couple of months and in the past as well. And it's not associated with the time of day. So the reason why you ask that is thinking about some sort of arthritis. Although I don't know how common it is to be in the back. Osteoarthritis, you're thinking like that you'd get joint pain basically after a lot of exercise because it's more wear and tear, whereas rheumatoid arthritis you'd get in the morning back pain. And the more exercise you do, actually, it helps that because you're warming it up. But not associated with any time of the day. Paracetamol, ibuprofen does not make it better, although in the past she has used diazepam, which has helped. It's a relaxant as well. And it's about 7 out of 10 when it does come on, the pain. But for the rest of the day, it's basically okay. She's completely fine until it just comes on and then it goes again. No other really concerns. Another thing she wanted to get out of the consultation as well is that she had like some sort of scan for gallstones. Yeah, so she just wanted the results from that. And often as well, when you get sort of blood tests or if you get a scan, if you don't hear anything, then that's normally a good sign. No news is good news, basically, in the world of medicine. Yeah, the one thing I didn't do in this history, which I should have done, I completely forgot about it. Yo, red flags, man, red flag symptoms. That's a very big thing. So basically, you sort of have to ask some red flag symptoms, meaning if you have any of these symptoms, then it's like thinking like something like malignancy, so some sort of cancer, red flag. It's not a good sign. So stuff like loss of control of the bladder, hesitancy when they have to wee, saddle anesthesia. So basically what saddle anesthesia is that if you get like numbness, or if you can't feel sensation properly, like around like the bum area, the anus, yeah. So if you get any of that's associated with cauda equina. So you can look that up if you want. Yeah, that was about it. When I called them back after talking to the GP, they didn't pick up. So that's up to the GP now. Next patient, 69-year-old female, presenting with exhaustion all the time, so shortness of breath and tiredness. So I was thinking about a few things. Initially, I was thinking about a few things here. So it could be something like heart failure with the shortness of breath. It could be just anemia because of being tired all the time. It could be hypothyroidism as well with the tired all the time as well. Shortness of breath could be like any sort of lung condition as well. Or actually in older people as well, depression can present like this as well, so very sort of slow, tired as well. So what I got out of her, so been out of breath when she walks to the shops, which is like 5 minutes, and so she has to take a break halfway through. It's been happening for a couple of months now, this sort of exhaustion all the time and shortness of breath and tiredness. And also another thing as well, she gets palpitations as well when she reaches the shop, or sometimes after walking quite a bit. When she walks up the stairs as well, she has to stop halfway through as well. There's no weight loss recorded. In terms of her bowels as well, she's on iron tablets, so they're not great anyway, but I asked if there's any sort of specific change along with this sort of exhaustion, and she said no, not really. The reason why I asked for bowels is hypothyroidism. So often when you get problems with your thyroid, if you get hypothyroidism, which means your thyroid level hormones are too low, then you can experience stuff like constipation, you're tired all the time, you're fatigued. You can be really cold all the time as well, so you can't sort of regulate your temperature properly. Basically, like your metabolism gets low as well, so you get weight gain as well. Like everything just gets slow in hypothyroidism, whereas in hyperthyroidism, it's complete opposite. Weight loss, sweating, very hot all the time, like heat intolerance, you're always really hot, and associated also like with stuff like diarrhea and stuff like that as well. But didn't find anything significant there. I checked for stuff like ankle swelling, chest pain, none of that, and she hadn't collapsed as well due to this exhaustion as well. She didn't lose any consciousness, and she's vegetarian, so she doesn't eat a lot. She doesn't eat meat. It's only fish. What she thought it was that it's down to old age. She didn't really have any other concern. I did find out she was feeling very depressed as well. She said she goes to sleep and then she hopes that she doesn't wake up. Then I had to ask like about suicidal ideation. So I asked, have you ever had any thoughts of harming yourself or anything like that? Or she said she had a past thought of it, but she said she could never do it because of her kids. Yeah, which is nice to hear. Often like family or friends, they are like the biggest protective factors. Family history, so dad had a heart attack and died from that. And yeah, she doesn't smoke or drink as well. And she lives with her son. Yeah, what she wanted was basically to find out what was causing this. That was the main concern. And also she wanted to know if her iron improved as well. At this point, I can't remember if I called her back, to be honest. But I just didn't have time, so I referred it on to the GP. That's the thing, man, like, you have to look out for yourself as well. There's only so much you can do. You have to just do what you can do, and then don't do too much, basically, because there's no sort of limit to what you can do. You can always do beyond the limit, but if you go beyond the limit, then you're just gonna compromise on the care you can give to other patients, but also as well, you're gonna be harming yourself as well. You're gonna overwork. So that's not a good thing as well. You need to look out for yourself. And also there's going to be always someone else to pass on sort of the responsibility of care as well. I mean, I'm a medical student as well, so I was thinking, yo, I need to go. I need to move, man. It was good. Yeah, biggest lesson is just to sort of how to deal with frustrated patients, which was great. Alhamdulillah, man. Another good day. Yeah, man. Look at my whip. Look at my scooter. Skirt. I'm out. I'm basically, I've gone to get a haircut. Look at that, man. It's kind of clean. It's not my usual barber, but I still give it an 8 out of 10. It's still good. And also I bought some chicken as well. As you can see, we start with the dance as well. Chicken tikka masala, yogurt, the aisle. Mix it all together. Make sure you're gonna get your hand dirty, man. I like to just use one hand for mixing and then keep the other hand clean in case I want to like get some foil. And this is literally the hardest part, actually, getting the foil, but I still managed to do that somehow. Throwing the rest of the chicken in the fridge and keeping my hands up like a surgeon to prevent contaminating any surfaces. England! England!
Stupidest thing I've ever seen.
Mr. Halftime thoughts?
Bro, that was sick. I wish I could be.
Hey lads, how was it?
Bit crap.
Wait. What the hell was that?
I had to wake up early today because I'm not. What is this? What the hell is that, man? That's why. That's oh my days. Yeah, I had to wake up early today because there's a vaccine clinic that my GP offered me to sort of help out in. So I'm doing that.
Yeah! Look at that! Looking clean! You know what they say, man? Staying clean keeps the corona away. Yeah, the weatherman said it was gonna be bad weather today.
Yeah, of course.
Yeah, the vaccine clinic was really good. So I myself personally, I didn't get to vaccinate anyone, but I wasn't too bothered. I vaccinated people in the past, given IM injections in the past. My role was to make sure that people were okay after their vaccine, because after the Pfizer vaccine, you have to wait for like 15 minutes. And it was, it was all right. And also, man got paid as well. So make sure if you're a medical student or a nursing student that you get these opportunities as well, because you can get paid as well. Woo! Seeing those glasses, yeah? Pow!
I've already told you guys about the driving range, and he's trying to be the next Tiger Woods, the Pakistani Tiger Woods.
I am the Tiger Woods.
Oh, sorry.
Watch this, watch this.
Why are you laughing for? What, Chris, why are you laughing for? Why are you laughing for? I'm being serious.
Oh, not bad, not bad. Oh, that's a beauty. Oh my God, that is still in there.
It's now Junaid and I at the driving range. This was really fun actually. Considering the last time I went, I got proper huge blisters on my hands because I was trying to whack it. And this time I was just trying to focus on just not putting as much power in, just like a bit of technique. I don't really know the technique, but I've seen it in the movies and on the TV, so, this time I just didn't try and smack it. But it was a lot of fun. It was really good. I really enjoyed it. Then we went off to the beach where we had some nice ice cream.
Daddy Junaid paid for us, innit?
It was Biscoff sprinkles with some Biscoff brown daddy sauce. I don't know, it's delicious. And then yeah! Chef's challenge, baby, do you see that? For the big man. Who's the big man? Huh? Who's the big man? Come on. We're at Akbar's and the food it's always delicious actually. You can always rely on Akbar's for making delicious food. But anyway, the big man challenge. You have to eat all that naan. So that one naan is just for me, yeah? Anas is doing the challenge as well. The one naan is just for me. And then a whole pot of curry. It's got chicken, lamb, potatoes in as well. Big pot of curry. And then a whole plate of rice as well. Which doesn't sound a lot. But do you know how many carbs is in that? It was so difficult. Look at me, man. I'm focusing. There's no time to talk to anyone, bro. I'm focusing on the food. I'm focusing on the goal. I went in that restaurant with a goal, with the aim, and I was forming a game plan, but it was so difficult, man. And I just want to take this opportunity to apologize to absolutely nobody, because guess what? We finished it. Yes, that's it. Look at that. Look at that. Last fork, last bits of rice in my mouth, in my stomach. Done. Finito. Who's the dad? I'm the dad.